This video of mine is about binge eating disorder, which is a serious eating disorder in which you frequently consume unusually large amounts of food and feel unable to stop eating. Earlier, I posted a short video about binge eating on this channel. I hope you have already seen that video, and today I am going to discuss this illness in detail. Well, almost everyone overeats on occasions such as having seconds or thirds of a holiday meal, but for some people, excessive overeating that feels out of control and becomes a regular occurrence crosses the line to binge eating disorder. When you have binge eating disorder, you may be embarrassed about overeating and vow to stop, but you feel such a compulsion that you cannot resist the urges and continue binge eating. If you have binge eating disorder, treatment can help. Now I will tell you the symptoms. Most people with binge eating disorder are overweight or obese, but you may be at a normal weight. Behavioral and emotional signs and symptoms of binge eating disorder include eating unusually large amounts of food in a specific amount of time, such as over a 2-hour period, feeling that your eating behavior is out of control, eating even when you are full or not hungry, eating rapidly during binge episode, eating until you are uncomfortably full, frequently eating alone or in secret, feeling depressed, disgusted, ashamed, guilty or upset about your eating, frequently dieting, possibly without weight loss. Unlike a person with bulimia after a binge, you do not regularly compensate for extra calories eaten by vomiting, using laxatives, or exercising excessively. Well, bulimia is another eating disorder which I hope I will make a video about that in near future, and that's the difference between bulimia and binge eating disorder, because in bulimia people also overeat, but they compensate by vomiting or using laxative. Okay, in this disorder you may try to diet or eat normal meals. I'm talking about binge eating. Okay, but restricting your diet may simply lead to more binge eating. The severity of binge eating disorder is determined by how often episodes of binging occur during a week. If you have any symptoms of binge eating disorders, you should seek medical help as soon as possible. Binge eating problems can vary in their course from short-lived to recurrent, or they may persist for years if left untreated. You should talk to your medical care provider or a mental health professional about your binge eating symptoms and feelings. If you are reluctant to seek treatment, talk to someone you trust about what you are going through. A friend, loved one, teacher, or faith leader can help you take the first steps to successful treatment of binge eating disorder. A person with binge eating disorder may become an expert at hiding behavior, making it hard for others to detect the problem. If you have a loved one you think may have symptoms of binge eating disorder, have an open and honest discussion about your concerns. Provide encouragement and support. Offer to help your loved one find a qualified medical care provider or mental health professional and make an appointment. You might even offer to go along. Okay. Now I will tell you the causes. The causes of binge eating disorders are unknown, but genetics, biological factors, long-term dieting, and psychological issues increase your risk. Now I'll tell you the risk factors. Binge eating disorder is more common in women than in men. Although people of any age can have binge eating disorder, it often begins in the late teens or early 20s. Factors that can increase your risk of developing binge eating disorder include family history. You are much more likely to have an eating disorder if your parents or siblings have or had an eating disorder. This may indicate that inherited genes increase the risk of developing an eating disorder. The second risk factor is dieting. Many people with binge eating disorder have a history of dieting. Dieting or restricting calories during the day may trigger an urge to binge eat, especially if you have symptoms of depression. Third risk factor is psychological issues. Many people who have binge eating disorder feel negatively about themselves and their skills and accomplishments. Triggers for binging can include stress, poor body self-image, and the availability of preferred binge foods. Now I will tell you the complications. You may develop psychological and physical problems related to binge eating. Complications that may be caused by binge eating disorder include poor quality of life, problems functioning at work, with your personal life or in social situations, social isolation, obesity, medical conditions related to obesity such as joint problems, heart disease, type 2 diabetes, gastroesophageal reflux disease. Also, you can develop some sleep-related breathing disorders. Psychiatric disorders that are often linked with binge eating disorder include depression, bipolar disorder, anxiety, substance use disorder. Well, on my channel there are good videos about depression and anxiety. You can find those also. Okay. Now I will tell you the preventive measures. Although there is no sure way to prevent binge eating disorder, if you have symptoms of binge eating, you should seek professional help. Your medical care provider can advise you on where to get help. If you think a friend or loved one has a binge eating problem, steer her or him towards healthier behavior and professional treatment before the situation worsens. If you have a child, foster and reinforce a healthy body image regardless of body shape or size. Discuss any concern with your child's primary care provider, who may be in a good position to identify early indicators of an eating disorder and help prevent its development. Now I will tell you about the diagnosis of binge eating disorder. Okay. To diagnose binge eating disorder, your medical care provider may recommend a psychological evaluation including discussion of your eating habits. Your medical care provider also may want you to have other tests to check for health consequences of binge eating disorder such as high cholesterol, high blood pressure, heart problems, diabetes, GERD, and some sleep-related breathing problems. These tests may include a physical exam, blood and urine test, a sleep disorder center consultation. Now I will tell you the treatment. The goals for treatment of binge eating disorders are to reduce eating binges and achieve healthy eating habits. Because binge eating can be so entwined with shame, poor self-image and other negative emotions, treatment may also address these and any other mental health issues such as depression. By getting help for binge eating, you can learn how to feel more in control of your eating. The treatment options include psychotherapy, whether in individual or group sessions. Psychotherapy, which is also called as talk therapy, can help teach you how to exchange unhealthy habits for healthy ones and reduce binging episodes. Examples of psychotherapy include cognitive behavioral therapy, that is CBT. This may help you cope better with issues that can trigger binge eating episodes such as negative feelings about your body or a depressed mood. It may also give you a better sense of control over your behavior and help you regulate eating patterns. Interpersonal psychotherapy. This type of therapy focuses on your relationships and with other people. The goal is to improve your interpersonal skills, how you relate to others, including family, friends, and co-workers. This may help reduce binge eating that is triggered by problematic relationships and unhealthy communication skills. Dialectical behavior therapy. This form of therapy can help you learn behavioral skills to help you tolerate stress, regulate your emotions, and improve your relationships with others, all of which can reduce the desire to binge eat. Well, this was about psychotherapy. Now I will tell you about some medications which are used in binge eating disorder. There is a famous medicine that is known as lisdexamfetamine demesylate, that comes with the name of Vyvanse, that is VYVANSE. And this is a drug for attention deficit hyperactivity disorder, and this is the first FDA approved medication to treat moderate to severe binge eating disorder in adults. This Vyvanse is a stimulant and that can be habit forming and abused. Common side effects include a dry mouth and insomnia, but more serious side effects can occur. Several other types of medication may help reduce symptoms. Examples include topiramate, that comes with the name of Topamax, which is an anticonvulsant. Normally used to control seizures, topiramate has also been found to reduce binge eating episodes. Well, earlier I posted a video on my channel about epilepsy, in which this drug topiramate is used. You can see that video, and that is very, very informative. Okay. However, there are side effects of topiramate such as dizziness, nervousness, sleepiness, and trouble concentrating. So discuss the risk and the benefit with your medical care provider. Antidepressants. Antidepressants may reduce binge eating. It is not clear how these can reduce binge eating, but it may relate to how they affect certain brain chemicals associated with mood. While these medications can be helpful in controlling binge eating episodes, they may not have much impact on weight reduction. Then there are behavioral weight loss programs. Many people with binge eating disorder have a history of failed attempts to lose weight on their own. However, weight loss programs typically are not recommended until the binge eating disorder is treated because dieting may trigger more binge eating episodes, making weight loss less successful. When appropriate, weight loss programs are generally done under medical supervision to ensure that your nutritional requirements are met. Weight loss programs that address binge eating triggers can be especially helpful when you are also getting cognitive behavioral therapy, as I told you before. Now here I will tell you some lifestyle and home remedies. Typically, treating binge disorders on your own is not effective, but in addition to professional help, you can take some self-care steps to reinforce your treatment plan. These remedies include: you should first stick to your treatment. Do not skip therapy session. If you have a meal plan, do your best to stick to it and do not let setbacks derail your overall efforts. Avoid dieting unless it is supervised. Trying to diet can trigger more binge episodes, leading to a vicious cycle that is hard to break. Talk with your medical care provider about appropriate weight management strategies for you. Do not diet unless it is recommended for your eating disorder treatment and supervised by your medical care provider. You should eat breakfast. Many people with binge eating disorders skip breakfast, but if you eat breakfast, you may be less prone to eating higher calorie meals later in the day. You should arrange your environment. Availability of certain foods can trigger binges for some people. Keep tempting binge foods out of your home or limit your exposure to those foods as best you can. Get the right nutrients. Just because you may be eating a lot during binges does not mean you are eating the kinds of food that supply all the essential nutrients. Ask your medical care provider if you need to adjust your diet to provide essential vitamins and minerals. You should stay connected. Do not isolate yourself from caring family members and friends who want to see you get healthy. Understand that they have your best interest at heart. Get active. Ask your medical care provider what kind of physical activity is appropriate for you, especially if you have health problems related to being overweight. Here I should tell you something about alternative medicine. Most dietary supplements and herbal products designed to suppress the appetite or aid in weight loss are ineffective and may be misused by people with eating disorder. And natural does not always mean safe. Weight loss supplements or herbs can have serious side effects and dangerously interact with other medications. If you use dietary supplements or herbs, discuss the potential risks with your medical care provider. Well, normally we do not recommend some of these alternative medicine products. Okay, you should seek professional help. Okay, so this was my video about binge eating disorder. I hope you will like this video. If you have any questions about binge eating disorder, you can ask me in your comment section.